Right, karibu sana. It is about 18 minutes past the top of the hour. How are you doing this particular morning? Karibu sana to Morning Cafe. My name is Stanley Nyuringita. Natumai uko salama. Now imagine you're a truck driver ama uko na biashara mahali to the Democratic Republic of Congo, and you have to travel from Kenya all the way to DR Congo just for your business. So how do you ensure that you're safe and you prevent yourself from what the Minister of Health, what the government is calling a public outbreak, the Mpox. Previously it was called the monkeypox. Right now it is referred to as Mpox by World Health Organization. And this particular morning, if you're part of that, and generally as a whole country, we really need to be keen on this. Last week on Friday, the Ministry of Health announced the 5th case of Mpox. So how do we ensure that we do not have more of these cases and have a whole other COVID-19 kind of a situation? Now, this particular morning, I have the right minds for this conversation. On my immediate left, Eva Moy, she is the director of North Star Alliance. She'll be telling us more about the North Star Alliance, as well as in the same place, Stephen Gishina, he is a clinician. Just to understand what, from the organization, what it does, as well as from the from the professionals, what they do. Karibuni sana.
Asante.
And welcome to Morning Cafe. So first off, Eva, I'll start with you. As you also tell us who is Moy and what the North Star Alliance does.
Thank you so much. As you said, first I want to thank you so much for having us this morning. My name is Eva Moy, and I work as the director for North Star Alliance. North Star Alliance is an organization that was formed in 2006 by TNT, Transport Logistics Company, and the UN World Food Programme to address the issue of healthcare along the transport corridors in Southern Africa then. And then in 2009, scaled up into East Africa. So our mission as North Star Alliance is to provide quality healthcare to mobile workers like truck drivers and the communities that they interact with. We set up roadside clinics along the transport corridors at the major transport hubs and border points to take care of this important population.
Right. Yes. And I think one of the most important population really is the truck drivers, as I was mentioning earlier, because the connection between Kenya and to the DR Congo and Aupokoyo Laini to that particular corridor, where other countries that are also recording quite a number of cases of Mpox as well. So you also deal with truck drivers largely.
Exactly. Long distance truck drivers particularly. And our clinics are located along the corridors all the way from the port of Mombasa to Malaba, and then crossing over to Uganda and to DRC.
All right.
Exactly.
So, Gishina, we've had the government tell us this. We have been telling Kenyans Mpox, be careful. But what is Mpox really?
Thank you, Stanley. As you said, I'm Stephen, as a clinician for North Star Alliance, working for quite a number of years and making sure that quality healthcare is offered to third transport communities and also the people they interact with. Maybe my viewer will like to know what Mpox, formerly known as monkeypox, and why a monkey?
Yes.
Why not elephant or chicken?
Yes.
In 1958, there was some scientists in Denmark that were carrying out some survey in monkeys, and they were able to identify the virus, and that's how it got that's how it was baptized, the monkeypox, and later the WHO called it Mpox. What Mpox? These are zoonotic disease, and if I say zoonotic, it's a disease for the animals, not for the humans.
Okay.
But in some instances, it can close and comes to human. So humans are vulnerable, and currently we have recorded 5 cases. And do we have some types of the virus? Yes, we have two types, and one is clade 1, that mainly you can see it in Central Africa.
Okay.
And we have clade 2 in West Africa.
Right.
And these viruses are spread according to the environment, to the behaviors of respective countries. So that's what Mpox is, and we'll also be seeing how it can be spread, how can you get the virus, how can you protect yourself, because again, this is a burden that is about to hit our country. Thank you.
So is it, which, is it clade 1 or clade 2 that is in Kenya right now?
Clade 1.
Clade 1?
Yes.
How different is it from clade 1?
It's usually the fatality case, because clade 1, the fatality case or the mortality case is between 1 to 10%, and clade 2 is around 1%.
Right.
So people should be very aware and actually practice personal hygiene, because I think prevention starts with yourself and myself.
Okay. Yeah. Before we come to Mwai, because you've rightfully told us about the whole journey, the history beautifully. Now, if again, ile hypothetical yetu, as a truck driver umetoka from Mombasa unaelekea mahali uko DR Congo kufanya biashara yako, how do you know that the person that you're going to be in contact with along the way maybe has Mpox?
Maybe before that, I forgot to tell you that the first case was identified or reported in 1970 at DRC. And that's why it's making DRC the hotspot where the infections are really spreading. So as a truck driver, transporting goods from Mombasa to DRC Congo, of course, that's the northern corridor. There are some signs and symptoms that you might have, and you are forced to go and seek some medical advice. First thing, it's the rash. This a small sore that can really start from the face downwards, can appear on your neck, your back, your palm, your private parts, your legs. And in social media, when we had the first case, I believe it was in 31st July. We were seeing a person with full of rashes all over. But we've seen some cases, like I think the fourth case, we didn't have a lot of rashes. So for a suspect case, even one rash is a suspect case. So if you have a rash, it's good you seek advice from the medical practitioners, and also from even to the grassroots. We have level 1, level 2, but nowadays they are called tier 1, 2, 3, and 4.
Okay.
There are other signs and symptoms that you can experience, like headache. And actually, when you're taking these medications, like painkillers, the headache's not going away. Sometimes you can have backaches. Sometimes you can have fever, which is not going away. Maybe you are popping in a chemist, buying some strong painkillers. This is not going away. And sometimes you can experience some lymphadenopathy, swelling of the glands all over. It can be one, it can be many. So those are some of the signs and symptoms, and not only for the truck drivers, for everyone who is watching me and the countries at large.
Right. As North Star, partnering with and dealing with long distance drivers and people who connect in this particular, the North Corridor, into countries that are really hotspot, like DR Congo, Burundi as well. When you talk to some of these drivers, because I know you have definitely dealt with them, as you're telling us, the kind of mobile population, what do they tell you? Because this, it takes you back to the COVID situation, where when such, even the government really puts it as an outbreak, then it's definitely a high and a big deal. Are they in panic mode? What do they tell you as drivers?
Thank you, Stanley. Firstly, let me start by saying that transport corridors are very important. And the reason why, as an organization, we were formed to address the issue of transport supply chain is the fact that the corridors themselves facilitate trade, economic development, and also, promote health. If we are not careful to ensure that there's a proper facilitation of trade along the corridors, then you can imagine what would happen. We have to protect the supply chain, and that's where the driver comes, because the driver, she or he, is the one that will have the responsibility of transporting goods from one place to the other. Mm-hmm. Everything that we use almost is transported by, through the corridors. So for the driver, when they move from one place to the other, their major concerns are the challenges and the risks that they'll encounter when they are doing their work. Mm-hmm. Their work is challenging. One, it's a job that keeps them on the highway 24/7, and they usually lack access to healthcare. If I may start by talking about health. Yeah. If a truck driver is unwell and is driving a truck along the highway, you can imagine if they are not well and they have to veer off from the road with their lengthy truck to maybe go look for healthcare somewhere. That is one big problem. The fact that they cannot easily access that service. Then the other one is the risks of insecurity. The fact that even the essential commodities that they might need are not readily available. That there are some stretches which are quite long, and if they got a problem there, or even a mechanical problem, that would be a problem. So what North Star does is to strategically place roadside wellness centers or clinics, which are converted sea containers, at places where they will access them very easily, at the truck parks. Right. And they are concerned about the diseases, of course, when we are talking about Mpox. And they know that they cannot avoid going to these places like Congo, which is the hotspot. Then they will panic. They will wonder what they should do. And so what they ask us mostly is what they can do to prevent themselves from contracting the disease and passing it on to other people.
So far, even after the first case, the 31st of July, that's basically the start of August, really. Have you had cases of some of this long-distance drivers saying, wacha kwanza ningoje, nione venye situation itakuwa before I travel? And that is also linked to, we'll be listening to Soundbite by Principal Secretary of Health, Mary Muthoni, talk about the same. But before that, what is the sentiment, or are they also reduced their traveling to some of these hotspot areas?
Well, knowing how the economy is and how badly we need the jobs that we have today, how would a driver say that they are not going to transport the food? There's the transporter, the employer, who also is relying on the goods being transported from one place to the other. They need their companies to grow. They need the income that they get from this transportation. Then the driver is the one that's charged with the responsibility of taking that good, the goods to the places. So how would I say that I'm not going? That would, of course, disrupt a lot of things, and trade and the economy as well. So it is how to ensure that the goods or the work that they do is done in a way that protects them from risks of contracting diseases like Mpox and other, Mpox, and even during COVID, they were still transporting goods and they still went, but it's how they are able to protect themselves, because we cannot say that we will not eat food.
Oh, yes.
Because it will not be transported from whatever we need from Congo is not going to come to Kenya.
Biashara lazima iendelee.
Lazima iendelee, Bwana Stanley.
Yes.
And so we have to just work together, ministries of health, transport, and all those concerned, so that the transport corridors are actually working effectively to do what they're supposed to do for the economies of the nations.
Most definitely. And speak of which, Gishina, we did see, I think it was last week, the Ministry of Health, as well as even for the transport, intensifying this strategies in, I think, JKIA, Wilson Airport. So not only even from the border points as well, but also even the airports, because people coming in from different African countries, from even globally really, coming to Kenya. So someone would wonder, because we've seen other screenings for COVID, for other kinds of diseases, for Mpox largely. If someone for this morning was to undergo that screening via Mpox, what will be happening? What do now, as a medic, what are you looking for?
Thank you so much. And I think we are doing well, because actually it's like we have a basis where we can start. Remember, we had COVID I think 2 years ago. And what are we really looking for for Mpox screening? Remember, I had said of the signs and symptoms.
Yes, yes.
Of course, there are some dangerous cases that we call asymptomatic. This is when a case or a person having Mpox viruses doesn't show any signs and symptoms. So basically, they are very key questions a healthcare worker would ask a truck driver. Number one, where are you transporting your goods?
Okay.
In terms of the supply chain. Remember, as North Star, we want a supply chain that is safe and healthy. So are you from Congo? Have you ever visited, in the last 21 days, have you visited a country that has reported an Mpox case? So that question is very vital. Number two, it's maybe if you have any of the signs and symptoms that I've talked of, like headache, the rash that I've explained from face downwards, some joint pains, some fever that is not going away, some swellings, funny swellings. You know, someone can come and tell you, I have a swelling here. And when you examine, you just see it's a lymph node that has swollen. And sometimes sore throat, like COVID.
So because all the symptoms that you're mentioning individually can be attributed to something totally different. If it's just sore throat, there's a corneli kunywa, my own things, and just have a sore throat individually. If it's a rash, as you were saying earlier, if it's because the previous one, it was just maybe one rash. And again, we're expecting a lot of rashes, let's say on the hands or on the face as well. If it's just a rash, maybe I have nilipitia mahali, or maybe I touched something and there's just a rash on my skin, that one. So as a medic, are you looking for maybe 5 out of 6 of all of these symptoms? How does that work?
There's some cases that we are calling suspect. So number one is rash, headache that is not going away. And also, the countries that you have visited also is very key as an individual.
Okay.
And also contact to the confirmed case.
Right.
Yeah. And that's how the contact listing is being done. For example, the fourth case, the contacts were able to be identified, and out of that, that's where we got the fifth case.
Right. Remember, keep talking to us. 22047 is our SMS number. 0793 267 279 number yetu ya WhatsApp. Ukitaka kutupigia simu in case you have any particular question concerning Mpox virus, there's this particular disease, 0795 045 864. The number ya kutupigia simu. TV47 KE is our Facebook page. Bwana Director, I don't know if you have that soundbite by Principal Secretary of Health. We listen to that because as we are talking about matters traveling, so that we come back to it.
Two who already have been treated and discharged. We still have the 3 who are in hospital, and we are looking forward to see them healed and go back to their families. We have enhanced our surveillance and screening at the ports of entry, and that is why that's what we have done to ensure that the spread of this disease does not get to move so quickly. We are also advising people that it is important to protect yourself. Stay away from somebody who has signs and symptoms of Mpox. Ensure you do not share clothes or items like bathing towels. Ensure you are able to clean your hands and keep yourself clean at all times. And should you have unnecessary travel to countries that have high prevalence or that have more of Mpox, it is important to reduce the travels until issues have really gone down. Therefore, it is also important to note that this is a collective effort, and we have agreed with the church that they will continue to preach to the people on the good ways, good public health practice issues at the household, with the coordination and collaboration with our community health promoters. We have requested the church, it is important to also give them a chance to say what they are doing in the communities. Taking of blood pressure, blood sugar, reminding mothers to go for clinic and to take their children for injection, weighing the children and ensuring that they...
Right. She mentions quite a number of important things there. Both of you, I mean, first off, what you're talking about, the quote-unquote unnecessary traveling. So if I'm going to the border, how do I assure that Apoko Border Control that this is a very necessary travel? How do you limit and say this is unnecessary and this is necessary? Mwai.
Thank you, Stanley. I think in most cases, you don't just travel for the sake of it, from my experience. But if you're, of course, traveling to Congo as a tourist to just go and see the forest and the nature there, I would say this is not the time to do that. And I agree totally with the PA's health.
Yeah.
But of course, most of the people who would be traveling to Congo at this time have a particular reason. Either you're going home, you're going to visit someone, you're going maybe to attend a burial or something like that. Or now the truck drivers who we said, because it's their work, they have to do it, they have to go there.
Right.
So it's just the precautions that they will take.
Right.
But again, I agree with the PS. If you're just going to see Congo, then avoid going to Congo.
Okay, Gishina, let's take a look at this particular press release for last week on Friday. It's quite a lengthy one, but then I'll just a bit of it. So it was to tell the country about the 5th confirmed case. And a bit of it says the patient has no recent travel history to a country reporting Mpox cases. Her spouse had recently traveled to Rwanda, returning on the 24th of August 2024. Now, the spouse is the 4th confirmed case. So let's take a look at those dates, because the first one was on the 31st of July. Yeah. And right now we are on is it the 12th of September?
Yes, that's barely a month and a half.
A month and a half.
Yeah.
Talk to us about the isolation, because for this case, they have to undergo a certain period of isolation away from people. And then there's obviously that incubation period as well. Talk to us about that.
You've talked of a partner that has contracted Mpox.
Yeah.
And this person have not traveled to an epicenter.
Yes.
In this case, we are talking of DRC Congo. Maybe I would touch on some transmission so that my viewer can be able to understand how can I contract Mpox. Because again, in the beginning of the show, I was talking of zoonotic, and it's an animal disease. So some of the transmission modes, it's from the animals to humans. Remember, there are some communities that practice hunting and gathering fruits. So whenever you interact with animals that are believed to carry the virus, for example, the families of monkeys, the rats, in some other cases we have squirrels and wild dogs. So whenever you interact with such animals, and I believe there are some communities who feed on monkeys, rats, so you have a high chance of contracting the disease. Then we are talking of human to human through, of course, skin to skin contact, through kissing, and through sex. Actually, these are sexually transmitted virus. And also sharing personal items. Maybe phones, gadgets, maybe sharing clothes, sharing towels. Those are the personal items. And finally, the transmission can also happen vertical transmission. The vertical transmission is whereby the virus can be transferred from the mother to the unborn child.
All right. Because at the end of the soundbite, I had PS talk about the prenatal care and the care for mothers and their children as well.
Yeah, and I've really liked how PS has said. Remember, the beginning of this regime, they have invested heavily in healthcare, especially at the grassroots. You've heard her talking of the community health promoters. And a lot is happening, Stanley, in terms of awareness and telling people how they can prevent themselves in churches, in chiefs' barazas. And if you are not aware of the disease, you can actually visit your chief. You can visit your the lowest level of healthcare. And you'll actually be informed on how you can prevent the disease. And this is the important thing to actually communicate to our viewers and Kenya at large. Yeah.
Right. I had asked you about the incubation period as well.
Yeah.
How long is it, and how does it now affect how we're going to, because so far we know as of last week on Friday, 5 confirmed cases in the country. So far, at that time, the PS had told us that there are about 650,000 people who have been screened.
Yes.
This is definitely ongoing on all border stops, as well as airports, where there's entry from people in different countries as well. That incubation period, how does it work?
The incubation period, it's in a layman language, it's when the disease can be detected in your body from the first contact with the virus. So the incubation period, it's between 1 to 2 weeks. Again, we have something that we call seroconversions. The time that the virus can now start, the time that the disease can be detected. Remember, we don't know. It's a range. So for this, between the incubation period, that's between 1 and 2 weeks. Remember, we have the isolation model that any contact from the confirmed case, it's isolated or quarantined. And that's ni kusema mnawekwa mahali, and then we monitor you for the next 21 days to see if you will develop any signs and symptoms. But again, this poses a danger because we have people who can't develop the signs and symptoms. And these are, we call them asymptomatic. They can't show any signs. They don't have headache, they don't have rash. But I think the government it's doing something about it so that we can have all those people tested, like the way we used to do with COVID, so that we can even detect the asymptomatic patients.
Does it mean now that, because as you're saying, that particular period, since the whole of a year incubation, about, is it 21 days? ama ni ngapi?
1 week to 2 weeks. That's barely 7 days to 14.
To 14 weeks. So
Days.
so far, in 2 weeks so far, 650,000 people screened so far. Are we expecting to see more cases maybe in the next coming months?
Definitely, yes. But I think we are doing good, like I had said earlier. And this is because maybe we have learned a lot with COVID.
Okay.
And as you had asked our director, are drivers worried to go for the trips? I think they also, we have created trust and confidence in the drivers, so that actually, this one can have a negative effect.
Okay.
Stanley.
All right.
Remember during COVID, things were very expensive.
Most definitely. Before I come to you, Moi, we have a caller, Lilian Mweni kutoka Machakos. Habari asubuhi, Lilian.
Nzuri sana.
Watu wa Machakos mnaendelea salama?
Tuko salama, huku ni jua tu.
Okay, pole kwa jua. Mkona swali au ni maoni?
Niko na swali.
Yes.
Ningetaka kuuliza hii Mpox. The vaccination, iko na vaccination, who should be a priority kupata hii vaccination? Ni kama COVID, venye COVID kila mtu alikuwa anaambiwa aende apate vaccination.
Okay.
Ama.
Okay. Na Lilian, kabla uende, kwa sababu wageni wetu hapa wanasema kuna awareness yenye serikali imepeana. Sijui kama pale Machakos mmeona hiyo ikifanyika, chief akiwaambia?
Tunaonanga tu kwa runinga tu, nyinyi mkituletea kwa habari, kwa sababu kama mimi nilitiwa tu through runinga.
Runinga, okay, sawa sawa.
Yes.
Asante sana Lilian Mweni kutoka Machakos. Salimia sana watu wa Machakos.
Asante.
Moi, just coming to you on the same, the bit of vaccination, and that goes to also the kind of guidelines that the government has put in place so far. So I don't know who is now better placed to answer on the bit of vaccination. Is it the medic?
Maybe I can say something little than, of course, the clinician found of it. One, we rely on the government guidelines entirely. And they know there's a lot of surveillance that is going on at the border points, as you mentioned. And the government knows at what time, to announce what. And at the moment, if the vaccine is not, kind of already in the country and people have been told to go for it.
Yeah.
The government is very, very keen and sensitive to announce the correct information at the right time. And I know Stephen will say more about this, but yes, there's vaccine, and the government will tell us at what point. But what I want to emphasize is that let's be attentive to what guidelines the government is announcing, what announcements they are making, and adhere to what they are saying. As an organization, we of course work very closely with the government. I remember when the Nakuru case was identified, the county health system started operating so actively immediately, and they sensitized all of us and even organized a very quick, abrupt meeting. Was it on a weekend?
It was on a Sunday.
On a Sunday evening. So that's how, abrupt and sensitive, the government is working very hard and ensuring that everybody who's concerned has the right information. So I don't know, Stephen, what you would like to say about the vaccination.
And also, as you come on that, someone would ask, the 5 reported cases so far, is it too early to talk about vaccines right now?
Again, I'll stick with what my director has reported, that although the vaccination is part of the prevention measures, I think we should wait for the guidelines and directions from the Ministry of Health, whether do we really need the vaccine, or can we do the awareness and the prevention part of it, and make sure that we prevent the disease before it overwhelm us. For Lillian from Machakos, you have asked her whether she's aware of any awareness.
Yeah.
Ningependa atembelee kituo cha afya karibu na yeye, and that's dispensary,
Okay.
health centers,
Right.
kwa sababu how healthcare promoters wamekuwa attached in those facilities, and that's why I was telling you, Stanley, the government has the Ministry of Health has invested a lot in those those people who are wearing jackets. Is it blue or turquoise blue, and it's written here the Ministry of Health.
Yeah.
Those are the healthcare promoters that
Okay.
can really even they are being sensitized. You have heard the director talking of how Nakuru County took immediate action. Actually, it was on a Sunday, and every stakeholder was brought on board to see how we, as a county, how can we prevent this disease.
Right.
Yeah.
As you mentioned that, I'm taking a look at that particular press release. They'd given a whole, some of these guidelines. Number one, talk about avoid unnecessary travel to countries reporting Mpox outbreak, direct contact with suspects or confirmed cases. If caring for such patients, adhere to preventive measures. Now, that's again another whole thing. So how do you now care for some of these patients? And now that goes to, let's say, medic as well. And then again after, mtu akishapona, what happens next? Kuna possibility again a whole reoccurrence, because when Kenyans are really dealing with something new to them, they try to go for something that is as close to whatever happened, and that would really be COVID. So the kind of caregivers for this particular person, how does that work, Stephen?
Remember, as a medic or healthcare workers, it's important to prevent yourself and also the people that we serve. Remember, you can interact with an infected patient and also transmit the same to the patients that will come after that. So some of the prevention measures are, as a medic, make sure that whenever you are offering services, please put on your face mask. And in some instances, it's important to wear your goggles. Back into COVID times, whereby we even worn some gowns to prevent ourselves. And also, whenever you are touching a client, it's important to wear gloves. And also your personal hygiene in your body and the environment that you are working from.
So this means it's an airborne
Yes.
Okay.
In fact, the transmission I mentioned about contacts, coughing, sneezing, so it's an airborne disease. And actually, I'm thinking it's more infectious than COVID.
Okay.
That one has not yet been proven right, but from my own perspective, I think it's more infectious than COVID-19. So we should not sleep.
Okay.
And again, for the truck drivers that we are serving, and also the community that we are serving, and that's actually our North Star mission, that we serve the truck drivers and also the people they interact with. It's important that each time you wash your hands, and washing hands, Stanley, is not just a 1 second time.
Okay.
You should use preferably running water, of course clean with soap. And for the truck drivers also who are traveling to Congo, please avoid interacting with such animals that I had talked about, the monkeys, the squirrels.
And now that also goes to what one of the guidelines here, they say avoid close contact with alive or dead animals. What does that really mean? Are we talking about all animals here?
There are some animals believed to contract the disease, the one I've mentioned. So even if you find a dead animal, that is wild animal, it's really very important to involve the public health officers to actually dispose those animals and give further guidelines on how we can actually handle the animal. Because we, Stanley, you bear with me, or you will accept my statement that some hotels, you might find some monkeys around, jumping, and also some rats, some squirrels. I'll not name the town because I don't want to to actually be biased, but it's important to protect, as hotels, it's also important to protect the people that we are serving, because some monkeys could be carrying the virus. Yes.
Right. Boy, so with this, before we take a short break in a minute or so, tunaweza rudi kuendelea with that train of thought after the break, but then this driver that is listening this morning, or someone who is involved in this long distance from upper Kenya all the way, traversing into countries that might be high prone, and that are actually high prone to Mpox. They're wondering, nikipitia mahali kama one of the centers that North Star has, do I have to pay this guy's money? Because one, for vitu kama screeniwa nini hizo vitu zote ndio, alafu nipatikane kwanza niko positive. How much money am I putting in here?
I would like them to know our model is a cost-effective model. Our truck drivers don't pay a single cent when they come to our centers.
Right. Hold that thought there. Now the fact that you've said that, so that we actually get to know why don't they pay and how all that kind of a treatment continues. This is Morning Cafe as we discuss matters the Mpox outbreak and the awareness of it. Right now, we do have 5 confirmed cases as of last Friday. We do expect the Minister of Health just to be giving us more of these updates. Stick around right here as we continue on this conversation.
Hey there friends, welcome to Kids on the Block, where fun and imagination come alive. We dive into magical world filled with exciting adventures and awesome friends.
What position were you in?
I was number 2.
What position were you?
Number 1.
He decided to cross the bridge by his house and look for food on the other side.
You're going to do half cup of chocolate chips, and the other one, we're going to do half cup of the blueberries.
So, grab your imagination hats and get ready to explore with us. Join us every Saturday at 9 a.m. for new friends, amazing stories, and tons of laughter.
Join us as we explore the journeys of those who defy the odds and break barriers. We dive deep into the stories of triumph.
Sometimes when parenting a child with a special need or whatever disability, family life becomes a bit complicated and you may end up raising the child on your own.
Here, we inspire.
I have a farm which one we showcase with other dyslexic youths and autism, how to farm.
Motivate.
It's never easy, but what we do, the best thing is to work with another parent who has an elder child than yours.
And break through the barriers one story at a time. Push your boundaries beyond the limit. Saturdays at 8 p.m. The Grind, where business meets brilliance. It's not just about the ideas.
I was working as a shampoo boy. I used to wash clients' hair on the sink.
It's about making them happen. From big wins.
In primary school, when we would be asked what people want to be, I was categorical that I want to be a nurse.
To hard lessons.
The consoles change, the gaming equipment keep changing.
We cover it all. Tune in to The Grind, where every episode is packed with insights.
The person who is serving customers, always be a customer-centric.
Strategies.
When you pay attention to detail, you get luxury items.
And stories to fuel your ambition. Don't just dream it, grind it. Mondays at 7:30 p.m.
Jiunge nasi tunapoangazia safari za viongozi bora. Kutoka kwa ushindi mkubwa hadi masomo magumu.
Wakati wetu kwamba wasichana si wa kusoma, ni wa kuolewa, ng'ombe ipatikane, wazazi wakuwe watajiri.
Tunashughulikia yote.
I wish I were a better investor.
My parents taught me how to look for things for myself.
Tazama Mfahamu Kiongozi, ambapo kila kipindi kimejaa maarifa, mikakati na hadithi za kukuza.
Welcome back. This is Morning Cafe. News truly Stanley Nyerungita. This particular morning we discuss matters of health, and our focus is on Mpox, previously monkeypox. So far, the country and the government has screened about 687,233 travelers getting into the 24 points of entry across the country. There are 5 confirmed cases as of last week. And before the break, we're just trying to really understand what is Mpox. As someone who traverses this particular routes from Kenya all the way to the hotspot, the biggest in Africa, DR Congo, recording so many cases so far. How do you prevent yourself on that? And before the break, I was throwing that particular question to you, Mwai. Mtu atauliza lazima nilipe, and you told us that it's free after all, but so fully this North Star centers, are they fully catered that? What actually happens in this particular center? Do you liaise again and collaborate with other level 2, 3, 4, 5 hospitals that are nearby?
Thank you, Stanley. Our clinics are equipped with staffing. We have a clinical officer in every of those clinics. We have somebody who tests for HIV. And we also have a team that goes out and works with the community health promoters and peer educators. We also train, people in the community, peers who can go out and educate people on health matters, whatever, topical areas.
All right.
And so from the clinic, you get the screening done. We do screening of various diseases, including not just the communicable ones, but also the non-communicable ones.
Kidogo tu kabla hii simu ikatike, we do have Gloria kutoka ni Busia. Yes, habari asubuhi Gloria. Busia ni ile pale iko karibu sana na boda. Sijui kama umesikia hii maneno yote ya awareness ya Mpox, lakini sijui kuna swali au ni maoni.
Niko na swali.
Yes.
Nilikuwa nataka kuuliza kama uko na mtoto mdogo ama kama uko na mimba, unazuia aje kupata hii Mpox, na kama mtoto wako pia anaweza pata hiyo Mpox akiwa bado ukiwa na hiyo mimba?
Right. Sawa. Asante sana Gloria kutoka Bungoma. Wacha Busia, sijui mbona nashinda nikisema Bungoma. Asante sana Gloria. I think the clinician can handle that as well. Stephen?
Asante sana Gloria kwa swali yako. Kama nilipokuwa nimesema hapo awali, ni kwamba unaweza abukiza mtoto ambaye hajazaliwa. Kwa Kiingereza tunasema vertical transmission.
Okay.
Na ni vizuri ya kwamba ulisikiza PS akisema ya kwamba ANC yani kliniki ambayo wamama wajawazito hutembelea. It's very important for them to visit that. They are usually a minimum of 4 visits, and that's where they are getting the awareness, the interventions. Na pia tuna wale watu ambao wako hatarini ya kupata huu ugonjwa. Ni kama wajawazito, watoto.
Huyo mtoto kabla azaliwe, are the signs and symptoms similar to mwenye now as a full adult? Signs and symptoms za huyo mtoto zitakuwaje?
It's the same signs and symptoms, and sometimes I talked of asymptomatic case. Testing is the confirmation result. Yeah.
All right. So
I would advise Gloria to make sure that he visits the antenatal clinic to get checked.
Okay, so kabla muendelee, tuko na Kezia kutoka Naivasha. Kezia, habari asubuhi?
Nzuri sana Tandri.
Asante sana kwa kutupigia. Uko na swali au ni maoni?
Niko na swali yangu inaenda kwa Steven.
Tafadhali rudia tena.
Okay, na swali yangu inaenda kwa Steven.
Okay.
Swali yangu ni kuuliza, hii monkeypox ni airborne ama?
Okay, so anauliza kama ni airborne.
Asante sana Kezia. Ni airborne. So ukikaa karibu na mtu anakohoa na ako na virusi, utazipata.
So Kezia, swali nyingine ama ni hiyo tu?
Ni hiyo tu.
Sawa. Asante sana kwa kutupigia. Salimia sana watu wa Vasha.
Okay.
So yeah, I mean, back to you, the kind of strategies that are there that North Star Alliance has on the same. Talk to us about that.
Yeah, thank you, Stephen, Stanley. So I said we use converted sea containers for a reason. They are cheap to set up, and then you can move them should the truck park change or move to a different location. So in the clinic, I talked about the clinician. There are people who will test you for HIV, and then we do screening and treatment of the various conditions that the patients will present with. And then we also have a team that goes out of the clinic and with community health volunteers and community health promoters, peer educators, go out and reach out to people who are not coming to the clinic to also provide health education, informing them about the importance of hygiene, about prevention of diseases. And I said at our clinics we offer a broad or a more comprehensive service package for the reason of we want to avoid situations where a driver will present with a problem that we cannot, that they may not be able to take to another place because of distance.
Right. Are we going to see some of these conversations on, because I see on your X page at North Star Africa saying the 2024 Regional Conference on Transport Corridors and Health. Just very briefly, are we going to hear some of these conversations there? Alafu tupate last thoughts, Stephen.
Thank you so much. North Star works with many partners. And we work with many partners because we know that in isolation we cannot achieve our goals. We work very closely with the Ministry of Health, County Health Department of Health, and the reason, and also one of our main partners along the transport corridors is the Northern Corridor Transit Transport Coordination Authority, which of course manages the affairs of the corridor to ensure trade facilitation. I cannot forget KENHA that provides us with the reserves, road reserves to set up our clinics. And for that reason, and because of the pandemics and epidemics that we continue to see, the emerging health issues and the need for surveillance, we have come up with the idea of holding a conference to bring together all foster synergies among the stakeholders and discuss matters, transport corridors and health, and the importance of ensuring that the corridors are working or operating effectively.
Okay.
And this conference, very important, will happen on the 2nd and to 4th of December this year, 2024.
Right.
Transport industry actors, health, academia, the communities themselves, so that we can see what strategies and how we can combat such problems like Mpox, COVID, and others that are, yes.
Most definitely. Stephen, in about 2 sentences, your final thoughts in a sentence, kindly.
Parting shot.
Yes.
My parting short comment is that please let's all people adhere to the Ministry of Health guidelines in terms of preventions. And who knows, that's why we are doing very well. For the last 1.5 months, we have 5 cases.
Right. Thank you very much. Eva Mwai, she's the director of North Star Alliance, as well as Stephen Gishina, clinician from North Star Alliance, as well as Santeni Sana. Najua back at home we learn a lot from this conversation. Umeandika notes, pia mimi nimeandika notes zangu hapa. This is Morning Cafe. We'll always give you some of this conversation so that you are in the know. This is Morning Cafe. Morning Cafe continues after this short break. I'm yours truly, Stanley Nyerungita.
Hey there, friends. Welcome to Kids on the Block, where fun and imagination come alive. We dive into magical world filled with exciting adventures and awesome friends.
What position were you in?
I was number 2.
What position were you?
Number 1.
He decided to cross the bridge by